Hi, good morning.
Morning.
Today we are going to present about hybrid imaging. Our topic we choose is angiography combined with CT scan.
Yes.
I am Chang and
Najwa.
Najwa. First of all, as we know that angio combined with CT, this is a combination of C-arm and CT scan machine. C-arm will be placed at angiography suite, and then for CT scan, it will locate at diagnostic imaging department. So actually both modality is not going to be merged together in previously. But with the nowadays technology, we can do it. We are going to explain about, first of all, we're going to know about CT scan and angiography differently. That only we come with the combination version.
As we all know, CT scan, the function of the CT scan is provide cross-sectional image, which is slice, uh, and it also provide 3D image of the internal organ and structure of the body. Um, so, okay, and also CT scan also provide the angiography features, which is CTA, and commonly we do the cardiac and coronary angiography. Unfortunately, CTA only provide diagnostic feature. So for angiography, we only use CT scan only for diagnostic, not for the interventional. So for the interventional, we go to the angiography, which is cath lab angiography.
Usually we known as cath lab.
Cath lab.
So for CT scan, just summarize that this only provide diagnostic value but cannot do the treatments.
Then this is the radiograph of the CT scan. This is the 3D of the heart, which is we call calcium scoring.
This one is CT cardiac, right?
Cardiac.
CT cardiac.
And then second one is the angiography of the brain. So we can see the
Circle of Willy.
the arteries in the brain, and
The
then
next, this one is carotid artery. This one is different.
this is also the cardiac CT. This is the 3D, so we can see that the blood supply for the heart is narrowing.
Or is there is a stenosis?
Yes, the CT scan of the pulmonary angiography.
Pulmonary means focus to the lung, is it?
Yes, the artery that supply blood to the lung. Yes. Okay, this is CT scan image.
Appearance of radiograph image in CT scan.
So the multi-slice of the CT scan can provide this beautiful image of the heart and the other organs in the body. We go to the angiography machine.
So for angiography, like not like CT scan. CT scan can provide slicing image, cross-sectional image, but for angiography, it only to visualize the movement of blood vessels and the organ of the body. So it can clearly see that the blood vessels and the organ and the blood vessels supply to the organs. And then usually it's performed in the angiography suite, means like just now I've mentioned, cath lab. Usually we call it at cath lab lah in the hospital. It provides treatment. Unlike CT scan, it's just only for diagnosis. So angiography provides two functions, diagnostic and therapeutic. For example, a patient diagnosed with coronary artery disease in CT angiography, but he or she can't get the treatment immediately. Why? Because CT is only provide diagnostic value. then he or she will undergo the percutaneous coronary intervention. That means the patient will undergo angiography, the patient undergoes angio for treatment. Okay, next, this one is the typical appearance for angiographic image. This one is the common procedure, call it chorus. And then this one is for the angio for kidney. As one, these two image, it's showing that this patient actually does have a stenosis here. This is stenosis over here. And then the patient will undergo the treatment immediately in the angiography suite. Like maybe patient will usually is balloon angioplasty or stenting. We'll do the stenting for this kind of stenosis. Okay. Can you see this? Yeah, sorry. Okay. This is the image video. This is stenting. Can you see the stenting? And then the doctor wants to check back after the stenting. Is it any blockage or any stenosis? This one is after stenting. Okay, the doctor will inject contrast. I'm going to see the blockage artery. But now this artery is okay. Unblocked. Already unblocked the stenosis.
Okay. Because they do the stenting.
Because the stenting.
Open the stricture.
Can we see, right, the stenting? This is the stent. We call it as a stent. Alright. So next, we're going to continue about combinations of angiography and CT scan in one room.
No, angiography and CT usually not share one room. Usually angio is at the cath lab and CT at the radiology department. So with this hybrid technology, the angiography and CT scan sharing one room and work together. Okay. And it's very convenient for patient and also the physician, which is it's easier for the patient so that we cannot transfer patient from CT scan to angio. So for this hybrid, we can do the diagnosis using CT scan and then simultaneously do the treatment if there any pathology of the patient. So it's easier for the patient and also easier for the physician or the doctor.
And it also saves the time for the procedure.
Yes. Yes. Patient do not have to do the appointment to do the treatment. It can simultaneously do the procedure of the treatment. Shares one table only. Two machine, CT scan and angiography. But use only one table. I will show you the video later. But I want to say that I want to tell you that two companies that provide this hybrid imaging angio and CT, which is Toshiba and Siemens. Toshiba, they use Infinix i4D CT that are very advanced in CT scan and also the angio. And for the Siemens,
the name is like Miyaba Angio CT and another Nezaris Angio CT. Actually, we found that one video, Singapore, right? Singapore General Hospital, it already applied this kind of hybrid. So I'm going to show you this video. This one is from the company of Toshiba. This one is the CT scan, the most advanced dynamic volume CT, and this one is the C-arm. And then when they're combined, they're sharing only one table, CT and Angio. As you can see the image,
and this hybrid imaging provide a lot of interventional procedure that provide easier for doctor to treat the patient without any complication. That's is the procedure, the new procedure.
different names of procedure. It can be performed, and then it can provide, for Angio combined with CT, it can provide anatomical and functional information like that. It can be seen, diagnosed, and can be treated. This is the typical view of the Angio combined with CT hybrid modality.
Okay, for the image acquisition, as we can see before in the video, image acquisition for this hybrid is, as we know, CT and Angio combined together. So image from CT and image from Angio combined together to provide a new image, new information, and the image can be utilized for the roadmap during the procedure, and it will be easier for doctor and physicians to do the procedure, and less invasive and save time. Okay, we can see I will show you the example. This is the roadmap for the liver artery, for the hepatic artery fusion. The 3D image from the CT scan of the liver combined together with the angiography image, and
this is the typical fusion of Angio and CT scan image, radiograph.
Okay, same with the this image, but this is the treatment for the tumor. It also use the same technique, and it's easier for doctor to treat the patient because of the roadmap,
because it provide proper guidance. It's like proper guidance during the embolization. So it's quite easier for the physicians to do the treatments and the procedure.
This is also the same, but different anatomy. This is for the kidney, for the face of the kidney, arterial face and the venous face. So as we can see, the above picture radiograph is about CT scan, 4D CT scan of the kidney and the renal artery. So after reconstruction, it combined the CT image, the 3D,
merged with the Angio
image, and we can see the radiograph. Yes, beautiful, right? Then it also apply the same technique for the venous phase. This is the venous phase from CT scan and combined with the angiography image. So this is the venous phase and this is arterial phase. Okay, the CT series provide the ability to utilize either the arterial phase and the venous phase. A video showing how we recon the image for 4D or 3D from the CT scan into the combined with the angiography image. So this is about the liver, 3D of the liver, Actually, they want only the artery of the liver artery and venous maybe. Okay, this is how we do it. We will the proper do it. Okay, only take the region of interest that we want. This is the software. This is how we do it.
Then make it fusion. When they fuse together, it will appear like
This is the artery that we want, the 3D. Then we combine with the image of angiography. We can manipulate it. We want to see it at the front. We
from
can
the rotate the image.
We can rotate the image. We also can collimate, zoom, whatever we want. So it's easy.
Finally, after we explain about the features of the angiography combined with CT, the advantages of this modality is 2-in-1. 2-in-1 means two modality in one room. Two modality means angio combined with CT in one room, and they're sharing only one table in the same suite. And both modality can provide consistent cross-sectional image whenever you need. So it can offer more anatomical and functional information. Advantages. Okay, next advantages. It saves time and money. In terms of save time and money, it's more towards to the patients because it can reduce time to and time of procedure. Since like previously, patient need to undergo two modality differently, not in the same day, probably. But now with angio and CT combination, the patient can undergo two modality on the same time. Next, for the workflow, it can improve the workflow of radiographer, more effective and efficient. Lastly, this is most important, it can improve and increase patient safety. Why we say that it can improve, it can increase Why we say that it can increase the patient safety is due to we no need to transfer patient from one bed to another bed. So the bed can be turned 270 degree and the CT machine can be moved in and the table will be moved towards the CT machine or either wise. So with this kind of technology, it can increase the patient safety and it provides like a new technique of treatment which the patient can be treated on the same table and patient no need to undergo like operation theater for surgery purpose because it become less invasive. So above is our presentations about hybrid imaging angiography combined with CT scan. Alright. Thank you. Bye.